I'd like to thank the Planning Committee for inviting me. I really have enjoyed this conference, and I really plan to take back a lot of the great ideas and put them into practice at home, I hope. So what I'd like to talk about today is some of the transdisciplinary professionalism, how we can kind of incorporate that into the teaching of public health. Figure out how to work this first. Here we go. And as kind of an overview, I'm going to say a few words about professionalism in public health, talk a little bit about how I would like to try to shape the thinking of my students in terms of transdisciplinary professionalism, and then look at some of the teaching and strategies that we can use perhaps to apply to our practice. My background, like many of you, is multidisciplinary. I started out in nursing. I went into medical anthropology. Then I spent many years teaching ethics, clinical ethics, at a large medical center. And then I had the opportunity to go down to Texas to the School of Public Health there and teach ethics and professionalism to graduate students in public health. So one of my thoughts was that when I got, even before I got there, I had to kind of figure out for myself, coming from this clinical background, what exactly is public health? And I talked to colleagues about this, and some of them would say, well, you know, public health is, it's not medicine, you know, it's something else. Other people would say, well, public health is this government-funded health care. It's sort of like Medicare, Medicaid, that's public health. What I eventually, there are a lot of formal definitions, like CDC and ASPH have definitions for public health, but one of the definitions that I came to embrace was not so much a definition of a discipline, public health as a discipline, but public health as a concept. And this is what I wanted to get across to students, that public health is not so much this discipline, but as a concept. And as a concept, public health embraces healthcare delivery, which most of my clinical students were in, disease prevention, health promotion, and health policy, all of the above in a sense. So there had been questions or discussions in the past about what is public health a part of medicine, or is a branch of medicine? Is medicine a branch of public health? We have in this country, I think we still have in this country, what is sometimes called a medicine-public health divide. And I think this sounds probably strange to people from other countries where they don't make this kind of disconnect between medicine and public health. But what happened in this country, I think, is as infectious disease became under control, there was a rise of clinical medicine, and it was certainly more prestigious, more powerful, and more effective. And so public health kind of faded into the background. This all changed with 9/11. Suddenly we had a renewed interest in public health, and at the same time we had a renewed interest in renewed attention to public health ethics and professionalism. So in a sense, public health is a little bit newer to the professionalism model than clinical professions, but there have been various approaches. Some people, particularly the Public Health Leadership Society, have tried to address the ethics and professionalism in public health practice, because that's mainly what public health professionals do. They practice public health. There have also been some of us who have tried to apply bioethics language to and concepts to public health as professionalism. And then there's been a human health and human rights perspective that has also been involved in discussions of professionalism in public health. Well, there are guidelines. Some of you may or may not know. I hope I'm not preaching to the converted here, but there are professional guidelines for public health, and there is a code of public health that was developed by the Public Health Leadership Society in 2002. You can go to the website and look this up. Another group that has been very active in looking at professionalism, it was an Association of Schools of Public Health. And they have looked at, or they've developed professional competencies for Masters of Public Health students. And they've also developed a kind of more advanced competencies for a Doctor of Public Health students. And just to give you kind of an example of what some of these concepts look like, there is a code of ethics. The Code of Ethics for Public Health is put out by the Public Health Leadership Society. They look at shared beliefs and values, and they also look at interpretive statements. They've come up with interpretive statements, just as, say, medicine and nursing have done with their codes of ethics. And some of the topics, the tenets of this code: public health should address causes of disease, requirements for health, aiming to prevent adverse outcomes. So again, we have this idea of do no harm. That is a concept that crosses all professions. Public health should should achieve community health in a way that respects rights of individuals. So again, respect for the individual is a tenet that is cross-cutting of other professionalism. I'm not technologically competent here. Okay, if we take a look at the ASPH professionalism competencies, again, for the Masters of Public Health degree, students are expected to promote high standards of personal or organizational integrity, compassion, honesty, respect. They're expected to distinguish between population and individual ethical considerations in relation to benefits and burdens and costs of public health programs. At the more advanced level of Doctor of Public Health, students are expected to be able to manage potential conflicts of interest at that level. So there are these competencies that we can sort of go to as standards for use and what we want to get across in our teaching. Another way of trying to get students to think about transprofessionalism, and when I was teaching this, I wasn't calling it transprofessionalism, or as maybe interdisciplinary professionalism, but I wanted students to sort of look at some of the differences between clinically based health professions and public health, and that there are both differences and complementarities. So if we look at clinical medicine, I'll call it for short, when professionals train in the clinical setting, they're sort of socialized into this patient-focused care. We talked about the patient-healer relationship already in this conference. And one of the issues is that because patients in a clinical setting are sick patients, and they're very vulnerable. When you're in public health, you're dealing with more of an ambulatory patient. The patient doesn't necessarily have an illness that causes a hospitalization. So they're a little bit more active, a little bit more there isn't that close kind of individual public professional relationship with the individual in public health. Though you could say that the locus of professionalism in public health is a relationship of that public health profession with a community or with a population, whereas the professionalism locus in clinical medicine is a professional patient relationship. Another kinds of aspects of differences and similarities in clinically based health professions, the language and concepts are primarily derived from biomedical thinking. In public health, the language and concepts are derived from ethical practice, from human rights, social justice. There are, though, shared values among both clinical professions and public health. These values may involve such things as justice, respect. They're also shared what we might call professionalism processes. And both public health and clinically based professions have to often weigh burdens and benefits in deciding what is the right thing to do in any particular situation. And just to sort of add to this even more, the IEP came up with interprofessional values and ethics competencies for professions, and I sort of pulled out the ones that had to do with populations, just as a sort of added interest here. So when we talk about teaching strategies, as I said, I came to the University of Texas School of Public Health wearing my clinical hat, and in a sense, I had to sort of had this sort of epiphany about what is public health. And it took me a little bit of time and work and thinking about these professional concepts before I was able to really, truly embrace a concept of public health rather than this sort of discipline of public health. And one of the things I did was when I was asked to teach an ethics course in public health, and they didn't really tell me what kind of a course. They assumed that would involve public health ethics because I had many students who were from the professions, who were doctors, nurses, social workers, who had this clinical background. There was a temptation to teach it as sort of a clinical ethics course too. But I decided again to commit to this sort of concept of public health and call it public health. I called it healthcare ethics rather than any kind of clinical ethics or public health ethics. So as I mentioned, because you had all these students, I had all these students from different professions, in addition to other students such as biology majors or lawyers, this was a good sort of captive audience for discussing some of these values that support these different professions. And one of the things I think we talked about too was, although we didn't call it that, was this idea of what are our responsibilities as as professionals to the individual and to society, to the community, and the whole idea of a social contract. And if there's time, I'll talk a little bit more about how we use the idea of a social contract in something like public health emergencies. If you think about, we've had several like hurricanes from Katrina to Sandy recently. Some of the issues that go on have both clinical and public health repercussions, and the professionals have responsibilities both to individuals and both to the larger public. The other thing about teaching professionalism, I think, in public health is to teaching that all work has value. And that if you think about, we talk about respecting patients, respecting professionals, we also, I think, explicitly maybe to think about respecting the person who does the housekeeping in the office, and because we'd have a real public health emergency if we didn't have that office clean, or if we didn't have a janitor around to sort of fix things when they broke. So one of the teaching strategies I used in my public health ethics course, it was a 3-credit course, so I could sort of change things around if I wanted to. And I used 1 credit as kind of a fieldwork experience. And I called it Professionalism in Practice. And what I did is that in addition to the 2-hour lecture discussion part of the course that they all had to do an assignment over the course of the semester where they did several observations of a healthcare team at work looking for these kinds of interprofessional values. And so, for example, some of us mentioned interdisciplinary rounds in intensive care unit. Another venue was sending students to the ethics committee, the institutional ethics committee, where you had people from different disciplines making these kinds of decisions that had both clinical and public health implications often. IRB, certainly research as dealing with populations is a public health issue. And being present at an IRB meeting for several times, so they get an idea of how these kinds of regulatory decisions are made, and to bring this back and to maybe write a little reflection paper about it to share it with the class. I thought these were some things that we used in this course. Just kind of in general, some of these are not very innovative teaching methods. I think many of you use them already in your own educational practice, but literature, I think, is a big way of teaching things like compassion, cooperation, values. Many of you maybe have worked in medical education. You may be familiar. There's a very popular short story called The Use of Force. It's by William Carlos Williams, and it's a story about a physician who this is in the 1930s, 1940s. The physician goes in there and has to examine the patient because she might possibly have diphtheria, and he goes through this progression of where the child refuses to open her mouth, so he's trying to pry this mouth open and becoming more and more angry at this patient. And it's a good case for medical students because it sort of gives them the idea of, okay, here you have this doctor-patient relationship. How much should that physician sort of force treatment in a sense on this patient because when she's in a sense refusing this treatment, for her own good, he talks about doing, forcing this child. The case is interesting, I think, from this sort of medical, clinical aspect, but I think it also has public health implications because one of the things that this physician is considering is that there's the possibility of a diphtheria epidemic in the area. So he has to really find out whether this child has diphtheria or not. So taking cases from literature, taking short stories, and really sort of drawing out the public health implications from, I think every aspect of clinical medicine is going to have, virtually every aspect, I don't want to say every aspect, has some sort of public health implications, and helping patients seeing the connections, the implications for interprofessional relationships and practice in these cases. I've also used, there was also, when we talk about games in the sense it's more of an exercise where in terms of rationing healthcare resources, we had everybody take the role of a particular individual. So there was one person who was a 10-year-old child, one person was a physician, one person was an artist who's been on great work all over the world, one person was a 65-year-old retired auto worker, one person was a professor of infectious disease medicine. And we sort of all went around and said, there's a terrible flu epidemic out there. It's killing people left and right. People need respirators. At some point, we're going to have to decide who gets that ventilator. Tell me why argue your case in a sense as to why you should or should not get the ventilator. And we had some very interested responses. The one student who was playing the role of the 65-year-old gentleman, who retired auto worker, said, I've lived my life. At 65, I'd like to live a little bit longer, but here we have children. We have infectious disease doctor who can help other people. I'll step aside and not accept this. So it was an interesting sort of exercise in allocation of healthcare resources too. Okay, the other cases, I think that, again, as I said, I think most clinical cases you can draw some public health professionalism implications. So if you're treating a substance user with endocarditis, there is that clinical issue of doctor-patient relationship in front of you, but there's also this larger issue of substance abuse within the society. Another great case, I think, is there's been a lot of talk recently about HIV prevention research. This is especially a global issue because there's a lot of pros and cons about what we should do for patients, whether we should provide this standard of prevention, the current standard of prevention. People are arguing for and against this, and many of these arguments have a sort of a potential for cross-cultural disagreement because we don't share often values from our own society are not shared in other societies. For example, the whole value of individual, the importance of the individual, it's a real cultural value in our society, and this may not be shared by other societies where the community, the family, is the sort of the locus of healthcare. Again, just in general, encouraging students to reflect holistically in the sense in this sort of maybe from my anthropology background, looking at the big picture and not just the individual picture. And I always like to say to people that, the decisions that you as a clinician make in that hospital have public health implications, just as the decisions made in public health have implications for individuals in society. So some of the challenges, I think, in teaching transdisciplinary professionalism, as in anything, there's a time and curricular constraints, trying to manage those constraints. One idea that I sort of took from a course, a one-credit course in a sense, called Public Health at the Movies, is just having maybe a student get-together once a month with students who look at a film that may have some kind of clinical implications, and have them look at both the clinical professional issues as well as the public health professional issues within that film. The other kind of challenge is that it's a little bit easier maybe to work with public health students who come from this sort of clinical background, who have this notion of this sort of patient-professional relationship, this sort of socialization process that they've come through, and it's a little bit more difficult. How do we teach the biology major? How do we teach the lawyer with no clinical background what's going on in clinical medicine? And how do they make them, get them to understand sort of the issues in clinical medicine? And I did have one public health student who was very interested in gerontology, which involves a number of professionalism issues. And what she did was she, not having the clinical background, she did her public health practicum, which is usually in a public health agency, but she did several little mini practica where she like observed at an ACE unit at University Hospital. She observed for a week or two in a long-term care facility, trying to get the idea of what is happening in clinical medicine that really has implications for public health professionalism. The other thing I sometimes get from students, especially my nursing students who go out into the Cleveland public schools, where everybody knows the condition of schools, they're resource poor, sometimes either in areas where students and families are very poor, and they say, well, we really can't change anything. And I think, again, this is one way where we need to go back to literature, to film, whatever, to teach students not only compassion, but the idea that there is policy, that you can impact policy, hopefully, at some point. And, perhaps there are some ways of dealing with things up the road eventually. Cultural differences certainly are a challenge, but again, bridging this through communication and interaction with other professionals, perhaps, and who come from different cultural backgrounds. The other thing is that in teaching trans professionalism, sometimes I come across faculty who say, well, I just don't feel comfortable. I'm teaching a a problem-based learning course. And yeah, we're talking about a case, but I don't feel we're comfortable incorporating something about ethics and professionalism into that case. And I think that most of the time, it's not that these educators lack the knowledge or the skills, but I think they lack the confidence sometimes. And that's where I think as colleagues we can help each other along, maybe help facilitate a problem-based learning session with them to kind of help them be more confident in their teaching ability. The challenges I think that we've mentioned before: evaluation, what outcomes are desirable, all these things that we kind of talked about before. And just concluding, I think very much the same things that I think we're concluding in this, many of us are concluding, is that we can change the attitudes as possible. It's not impossible, and that, again, changing society's thinking as well.
Thank you. Thank you very much, Jacquelyn. I also noted that she brought up the inclusion of individual students in that case who come from the communication realm. And certainly we have found that involving students from electronic media and film and communication and faculty in our discussions has been very helpful, because a lot of what we do is about the message and how do we say it and how do we communicate it to a broad audience. So we've found that incorporating those individuals into our team has been incredibly helpful. So I would like to now introduce Patricia Werhane from the Institute of Business and Professional Ethics at DePaul University to expand upon the focus on ethics in this realm.